Modern artificial intelligence is colliding directly with one of the most highly regulated, hands-on clinical professions in healthcare. For dental hygienists, this collision creates a massive amount of anxiety, but also an extraordinary opportunity. Welcome to the Trent University DHPO AI Micro-credential course. I'm Sophie Andreu. Over the next few weeks, the objective is to take the hesitation of "I don't get AI" and build the clinical confidence of "I can safely do that." We need to address the most common fear right away. Artificial intelligence is not a practitioner. It cannot replicate the human touch or the clinical expertise required to treat a patient. It is strictly an amplifier of your digital efficiency. Right now, manual charting and documentation consume up to 30% of a standard hygiene appointment. The primary function of the tools we will cover is to act as a high-speed processor. They absorb that repetitive administrative burden so you don't have to. Mastering this technology allows you to reclaim that lost time. You can take those 15 to 20 minutes per appointment and reallocate them directly to high-value, hands-on patient care. Before we touch a single piece of software, we have to construct an absolute regulatory perimeter around our practice. This is your digital tray setup. The College of Dental Hygienists of Ontario provides the governing framework that dictates exactly how these tools can be integrated safely. Rule 1 is the strict safeguarding of privacy. It is absolutely prohibited to input identifiable personal health information into public large language models like ChatGPT or Gemini. Rule 2 requires informed consent for AI tools used in the operatory. Rule 3 dictates the supremacy of your professional judgment. Since algorithms can hallucinate, the hygienist carries absolute liability. Tools must enhance, not replace, clinical decision-making. These guidelines are not roadblocks to innovation. They are necessary guardrails. By ensuring only anonymized system or workflow data crosses the digital threshold, practitioners can leverage powerful tools without compromising ethics. If integrating these systems requires such strict compliance, why adopt them at all? The answer lies in how patients discover independent practices today. We are moving away from traditional search engine optimization and entering the era of AI-driven geographic routing, or AI-geo. In the old system of discovery, patients clicked through pages of generic Google links. Today, patients ask language models conversational questions like, "Find a hygienist near me." The machine provides an immediate, specific answer. To generate these answers, language models actively scrape and synthesize local data, routing information, and patient reviews. They generate highly specific, definitive recommendations that often bypass traditional practice websites entirely. Because of this shift, optimizing an independent practice for AI-geo is no longer an optional marketing tactic. It is a mandatory survival skill to remain visible in the modern healthcare market. With the ethical boundaries set and the market stakes understood, we have to look at how practitioners actually interact with these models. This requires prompt engineering. You need to treat the AI exactly like a newly hired administrative assistant. It requires highly structured, explicit instructions to succeed. The standard methodology is the REACT prompting formula. R stands for role, assigning a specific persona. E is expectation, dictating the output's goal. Action outlines the tasks. Context provides your practice parameters, and tone ensures a professionally appropriate voice. Let's apply this to a patient education writer. You tell the system, act as a patient education writer, your role, for an independent dental hygiene practice, the context. Explain periodontal disease, the action and expectation. Finally, make it friendly and accurate, establishing tone. Defining the context and tone within this prompt acts as an immediate safeguard against clinical hallucination. It forces the system to stay within plain language, non-diagnostic boundaries. You can use this exact same framework to build a regulation research assistant, prompting the machine to navigate complex Ontario compliance sources quickly and isolate specific rules. By utilizing the REACT framework, you strip away the unpredictable nature of a generalized chatbot, turning it into a precise, highly controlled clinical assistant. Our digital tray is now set. We have established that these tools are strictly amplifiers, bounded by CDHO ethics, and directed by the precise logic of the REACT framework. Over the coming weeks, we will apply this exact foundation to active patient communication, automated clinical documentation, and real-time voice scribing in the operatory. As we move forward, keep the core operational philosophy in mind. This technology is designed to replace repetitive work, not the worker. Your assignment for week 1 is to log into a foundational tool like ChatGPT or Gemini and execute your first complete React prompt. Make sure you use strictly non-clinical, non-identifiable data. The rules are clear, and your foundation is secure. You are now fully equipped to begin safely architecting the future of your practice.